Hello and welcome to our podcast Public Health Uncoded with Dr. Saroj Pachauri, brought to you by Center for Human Progress in partnership with the POP movement, where POP stands for Protect Our Planet. Dr. Saroj Pachauri, a public health expert, provide commentary on some of the major public health issues of the current times and the various determinants of public health at play with high risk and vulnerable groups. Every month, Dr. Saroj Pachauri, a doctor of medicine and a distinguished public health scholar with over 60 years of experience, will unpack key public health concerns and opportunities in the current global arena with evidence and insights. Hello, I, Drishya Pathak, welcomes you to another episode of our podcast. I'm thrilled to announce that starting this month, we will bring you not one but two insightful podcasts every month. Today, our discussion centers around the crucial field of health communications. It serves as the lifeblood of public health. Without effective communication, addressing public health concerns become an uphill battle. It necessitates the use of diverse communication tools and strategies firmly grounded in research and evidence. It is vital to ensure that this communication is devoid of any misinformation. But even the history of communication tools is an intriguing journey that has evolved to meet the ever-changing needs of the public and various programs. Joining us today is Ms. Anjali Nayyar, who brings over 2 decades of expertise in global health. She specializes in developing comprehensive strategies for health policy and practice, managing programs across Asia and Africa, and has held key roles in organizations like Program for Appropriate Technology on Health, very well known as PATH, and International AIDS Vaccine Initiative. Ms. Anjali is also actively involved in various health-related committees and advisory groups. So let's welcome Dr. Saroj Pachauri and Ms. Anjali Nayyar to take over the discussion.
Hello, Anjali. Welcome to this podcast. I am so delighted that you agreed to lead this discussion. I'm honored that you have agreed to lead this discussion on health communication. Health communications has been an area that you worked with for decades and an area that you have extensive expertise and experience, and I'm sure that your inputs and your perspectives would enrich the discussion undoubtedly. Now, it's interesting as we look on the area of health communication that there are two broad areas within it, the medical and the public health. And the experience in the two cases has been quite different. In the medical area, where clinicians and medical doctors are involved, communication has always received a short shift. Doctors are known for their inability to communicate, their lack of ability to communicate. And that has always been an issue. And yet, when you look back some decades back, we find that there used to be the family physician. And the family physician was one who provided all the communications on health matters to the entire family. In fact, was a counselor for the family. So those were the days of holistic medicine. And those days seem to have gone away. We are now in this present era, we are in the era of specialization, where we have a nose doctor, an eye doctor, an ear doctor, and medical care is quite fragmented. So the story is quite different in the medical arena. On the other hand, in the field of public health, there has always been a great consciousness to have strong communication programs. Health communications has always been seen as a very important area in the area of public health. The most recent example is that of COVID. COVID starkly showed us how important health communications are, and it also underscored the problem of miscommunication, which can be a major problem. Now, I've written 2 books on COVID, and you have been so generous in contributing cutting-edge work in your chapters in both the books. Thank you so much, Anjali. So we have this problem, health communications and miscommunications, and the health communication arena has changed over time significantly. Also, the methods and modes of communication have altered and changed. So in the good old days, we had television, we had radio jingles for mass media. Today, there is the entire change in the area of mobile phones, the internet, the web, and so on. And so there is a significant shift in the way communications are carried out, especially by the younger generations. It would be very helpful for our viewers and our readers if you would, Anjali, paint a picture of how you see this whole scene of communication over time, and what are the means and methods of communication that you think are most useful and how they can be employed, and say a few words about the area of miscommunication, which is becoming increasingly problematic in today's age.
First of all, thank you so much for thinking about me. I think it's an honor for me, quite frankly, given that whatever I've learned in the area of public health, reproductive health, uh, or broadly development issues is literally at your feet. So I couldn't be happier to be here talking to you about it. I think you're right. Communications has changed so much. It's dramatically different from the time when I was working with you. And you were one of those pioneers who felt that communications had to be an integral part of research. Otherwise, there was no point. It's completely different today. I mean, and it's really mostly about the explosion, the internet explosion, so to speak. It's just made it so much more interesting, so much more diverse, and yet at the same time, so much more challenging to really make sure that the right information, the right data, right evidence, and right messaging gets to the people. You started by talking about medical communications and doctors and how they communicate. I think you're right in the sense that everyone is a specialist. At least most of them are specialists today. There are few internal medicine, family physicians, as you call them, but the specialization has made them a little narrower in their understanding and what they communicate. But what they communicate is very good. It's very important. It's very knowledgeable. And they literally have that information on their fingertips. So it's good. But it can leave the recipient of the communications, a patient or even any other person, very confused. So if you're talking about, let's say you're going to an endocrinologist and at the same time you have a kidney problem, you are confused. How are you going to marry the two diseases, so to speak, and do the best for yourself? Public health is a different thing altogether. And I have to say that folks working in public health, and like I said, you've been one of the pioneers, have now recognized the increasingly important need for communication. And I saw that incredible change during HIV/AIDS, where it was so important to get the message, particularly about behavior change, to how to protect yourself, how to make sure that you can, well, protect yourself from getting HIV infected. And information was the only thing that you could provide. And communications tools had to be used in a different way. There have been, one of my favorite example about HIV/AIDS communications was when Rock Hudson went and Magic Johnson went on television and said they were HIV positive. And that changed the entire outlook towards HIV. So communications is absolutely, absolutely integral. It's an important part of public health. Without communications, I mean, I can say that without communications, we are not going to achieve the public health outcomes that we are really looking for. In terms of the platforms and mediums, there's an explosion. We have the traditional media and we have the new media. And, the newspaper articles, blogs, your music, your jingles, your infographics are all available digitally. But that doesn't take away from the traditional media. Television is still important. Radio is still used as a major means of communications in countries that are not economically advanced and have a large number of poor people. Also, radio strangely enough, is also something that women still reach out to, even though there is an internet explosion, because there is a limited access for women to telephones, to phones, so that they can use the internet. So I think, to me, communications is a blend of traditional and new media. If you're I've seen a lot of people who would still like to have an opinion article in the print media. But that same opinion article, we can use new media or social media to disseminate it widely and in real time.
This is so interesting, Anjali. Yes, the blend. What you're saying is that we need a blend of the traditional and the modern and get the best of both the worlds, because
Yes.
there are different audiences, women, for example, or poor women, for example, who have access to only some forms of media and not others, and who prefer some forms of media and not others. And they would be left out if we didn't use the traditional media. Very, very interesting, I must say. Tell me, Anjali, what do you see at present as the major challenges in communication in the field of public health? What are the major challenges, and what are the areas or the public health issues that we really need to address currently?
So I think there are two main challenges that I see.
Mhm.
One is too much information, and the other is really too little and misinformation. So it's a little information that can be interpreted any which way. So for too much information, it's much more easier. You can coach people to put out the right kind of evidence in a way that can be consumed by everyone easily. Most of the research papers, and again, something I've learned from you, most of the research has to be written in easily consumable messages that people can learn, imbibe, and change their behavior. Too little information is really dangerous, and sometimes it can be misinterpreted. And a lot of times it's just evidence that has been twisted in a particular way. So to me, that's a bigger challenge. And here is where I think experts have to play a much bigger role. A lot of times I have seen researchers and other public health experts who say, I don't want to get into a fight over social media.
Mhm.
But I think they are moving away from their principal duty of getting the information out. If you've done the research, it doesn't mean anything unless it's out there and used by people. So I see a bigger role for researchers, and I see a bigger role for public health experts. A lot of people are recognizing, I think they need to play a bigger role on social media, because it's out there immediately. It can be updated. If you've put in and you've got additional information, it can be updated. You can also use it to have a conversation, Twitter chats, Facebook Live. All this can be used. And also you can showcase infographics,
Mhm.
quotes. And there are just so many ways that you can make it interesting, easily consumable. And I honestly feel it's time for just about every researcher. They're doing it. It's definitely better, but we need to have more of it out there.
Yeah, I think you're right. We need more of it. We'll always need more of it. There's more research, but research doesn't end at research. Research has to be shared, disseminated, used for advocacy, and used for programs and so on, which I feel strongly about. But
Yes.
can you say a few words more about the misinformation problem? Because this is also a very difficult problem. So, what can be done? What are the strategies to counter misinformation? And why does it happen?
Why does it happen is, I think, probably needs an entire research on its own. I think Dr. Tedros was right when, during the time of COVID, he said we're fighting an infodemic. There was so much information out there, or misinformation out there. Some of it was understandable, in the sense it was a virus we knew nothing about. Everything was changing so rapidly. Every day there was new research coming out, new evidence coming out, and people wanted it to get out there as quickly as possible. So even in terms of the preventive medicines. It went from everything, there was this entire information on how you need to take anti-malaria drugs, and that will prevent you, till it showed that it had no effect. And all you needed to do was, in most cases, take a paracetamol and plenty of fluids and rest down. So I think one of was where it was not helped. The other places, it's actually deliberate, or it's your own viewpoint. So the one point here is looking at some of the Ayurveda medicines or homeopathy. And when you have people who haven't done enough research or don't have the full information, put out remedies that others can use and maybe fall even more sick, that is a big challenge. And quite honestly, it's really something that everyone is struggling with. I just see it's more people have to put out the evidence. Again, people who know better need to counter it, or need to at least put out the right messages. If they don't want to get into a fight over social media, at least put out the right research. But most importantly, I think most agencies, again, a lot of them are doing, most agencies need to invest in countering misinformation. They need to fund projects that specifically counter misinformation and put out the right evidence. For all of us to be responsible, a lot of us are. I think 95% of the people are responsible, but the 5% can cause a lot of damage.
Well, you've given several examples. The one that I would like you to comment more on, which you didn't mention, is the vaccine. The vaccine is a pillar for COVID prevention. And vaccines were, there was a tremendous amount of misinformation on vaccines, and continues to be, actually. What do you say about that?
Well, unfortunately, vaccines have suffered the most. Even before we saw the advent of social media, I mean, the whole thing about vaccines and autism, it caused so much damage and continues to do that even today. There are a lot of people we know who will not take vaccines or not allow their children to take vaccines. And this is even in developed countries. So vaccines, unfortunately, have suffered a lot. I also think that this is a time to change the nomenclature. It's vaccination that saves lives, not vaccines per se. Of course, you can't do vaccination without vaccines. But with COVID, some were genuine concerns. That there's not enough research, there's not enough evidence, I'm putting something in my body. Some of that was genuine concerns, and a lot was done to put the right evidence there. And I think in a lot of countries, you had the leaders and the influencers taking vaccines so that it would build confidence. In COVID also, those who were the skeptics, those who were against vaccines, I think that came to the forefront even more. And they found here an opportunity, literally, to say that, see, it doesn't have enough evidence. Most vaccines are out there. There's not enough research. I think some of the vaccines are the most cost-effective public health measure. And till date, of course, India's done a great job with vaccinating people against COVID. And I think a lot of people came out voluntarily and got the vaccination. But we still have to do a lot better on others. We still haven't done anything about HPV vaccine, which is one of the safest vaccines, and it prevents so much suffering. So unfortunately, vaccines have really been the target of a lot of misinformation. So again, I think more evidence out there, more people speaking for vaccines, and literally flooding the media with the positive stories about vaccination.
Thank you, Anjali. This is excellent. And finally, a few words, if you would, about information dissemination and health communications. What is the difference here? Can you give some examples to illustrate the differences? What does it mean?
So, dissemination is really one-way communication, and it's the targeted distribution of messaging or research or data. So if I have a paper and I wanted to get to a few people, I will create that list and I will disseminate it to them because I want the information to get to them. Communications is a two-way street, and I am communicating about promoting the action itself. I'm communicating about the project. I'm communicating about the behavior that I want to change. It's much more broader. But dissemination is to me, a very important tool of communications. If I want to communicate, I first have to disseminate the information, and then I can have a dialogue.
Thank you very much, Anjali. Your discussion has been outstanding as always. Thank you so much.
Well, I've had a good teacher.
Thank you so much.
All right. Thank you for inviting me. Thank you so much.
That was an interesting and important conversation. Dr. Pachauri initiated the conversation by emphasizing health communications, categorizing it into two broad areas, medical and public health. In response, Ms. Anjali Nayyar shed light on the challenges faced in effective health communication within these domains. She discussed how the era of specialization has resulted in fragmented medical care, making it difficult for patients to relate to multiple health conditions simultaneously. In the context of public health, she underscored the significance of robust communications program, noting the profound impact on the internet explosion on communications dynamics. Nevertheless, she also emphasized the importance of striking a balance between traditional and new media in the realm of public health communication. Ms. Nayyar candidly discussed the challenges within the health communication, highlighting that while the majority of individuals are responsible, a small percentage can have a significant impact by spreading misinformation. This can occur due to insufficient evidence on a topic or during a new health emergency such as the COVID-19 pandemic. To address these challenges, she advocated for organizations allocating resources to combat misinformation. Additionally, she stressed the vital role of researchers in effectively communicating their findings and engaging in conversations and dialogues to disseminate accurate information. Well, Public Health Uncoded itself is one such effort of information dissemination by experts. So if you have not listened to the previous episodes and are looking for the correct information on some of the major public health concerns, then subscribe to us. And if you wish us to cover any specific subject, then please drop a comment. Also, if you would like to show your support to all the research work that we do, then please visit us at www.thepopmovement.org and make a contribution. Thank you so much for joining us, and stay tuned for this month's next episode on the issue of climate and health.